and welcome to our weekly show, Tea Talk, where we'll be discussing latest updates, news, what's buzzing on the social media, as well as all that you need to know to have that ease of living in this beautiful country. This week, what we'll be talking about is not something that has been occurring recently, but has been going on since the COVID-19 pandemic hit across the globe. Yes, I'm talking about the psychological impact, or as we say, mental health issues that were caused due to COVID-19 pandemic across the globe. And for that matter, we have a lovely guest joining us today. So let's welcome Sahar Salmanian, who's the counseling psychologist and head of relationship department for Whispers of Serenity. Thank you, Sahar, for joining us today. It's such a pleasure to have you on our show.
Thank you for having me today, and hello to everyone. I think it's very nice to be here this week because this week is dedicated to International Women's Day, so we all are celebrating women's this week.
Absolutely. You know, on that note, Sahar, I would like to wish you the same. And it's a pleasure to have you in the week where, as you said, that we are celebrating International Women's Day.
Yeah.
So what has been going on for the International Women's Day?
So we are trying to look at women's in different aspects, and we are having different events today, tomorrow, the day after tomorrow, and Saturday, different kind of events for women to celebrate being a woman and inspiring other women.
Oh, that's beautiful. Now, talking about the topic, Sahar, you know, before we get into the detail how COVID-19 impacted the psychological, implications of due to the pandemic, you know, there was a time when mental health was a taboo to talk on its own, especially in the Sultanate. How do you see the shift in that?
Well, I can say fortunately it's getting better day by day. And as you see, people are talking about mental health daily, and you can see on social media that there are lots of accounts educating people about mental health. And I guess social media has a huge role in promoting and spreading the awareness around mental health. And we can see the rising numbers in clients that we are receiving in the clinic, and that's a very good proof to show people are accepting mental health as a priority. Right. And although there is still a stigma around it, and I guess that's why we have to continue talking about it in different ways.
Right, absolutely. Now, especially during COVID-19 period, we saw that a lot of emphasis, a lot of efforts were laid for people who were dealing with mental anxiety or mental issues or some kind of, panic attacks due to the pandemic that we saw coming from nowhere. How do you see the role of psychologists and counselors, especially during those times?
Actually, counselors and psychologists alongside medical frontliners were fighting with this new challenge to ease the situation during these 2 years. And of course, it was a new challenge for this sector as well. And as our part, Whispers of Serenity and Not Alone, which is a mental health campaign, we initiated something when COVID started. We initiated a support line, which was for free, 10 minutes WhatsApp messaging for everyone on a daily basis. So we allocated different counselors and psychologists to be there for people if they want to reach out us, to text us and share their problems with us. And that was a very amazing experience for us. We learned a lot. And we had a lot of people approaching us, not only from Oman, from all around the world. And I guess that was, a very good evidence for us to see in difficulties how much we need to have someone to rely on, to listen to us and to understand us.
Absolutely, Sahar. I'm sure during that time it was quite challenging for both psychologists and people who are seeking help, because if I'm not wrong, it's usually a face-to-face conversation where you're sitting with the person, or, when you're seeking help, you're actually there in person. How difficult was it really during that time, for not having that kind of conversation?
Actually, in the beginning, it was a little bit challenging because people used to come to the clinic to have in-person sessions. But I think that's a very positive thing about human beings, that we get used to everything. And it took a short time for everyone to get used to this new platform. And I can say that nowadays, having online counseling sessions and online services has been taken places very easily, and people accept it. So now we have a lot of clients who prefer online sessions because it's easier for them to sit at home and just open their laptop and have the sessions. So I guess now online services is part of our life, and we accepted it easily. So maybe that's a good part of the COVID.
Yes.
Pushed us to welcome this new version of therapy.
Absolutely. As you mentioned again in the beginning, that, social media played a really critical role, especially when it came to mental health. And like you said, now people actually prefer online sessions because, first of all, there's no effort put in from them to come to the clinic or to sit with the person.
You save your time.
Exactly. And you can just be anywhere in any part of the world, and you can just have that kind of comfort and ease to have that person to talk to you. Talking about that, I'm sure there was time when you were receiving a lot of queries, a lot of feedbacks. Are you still receiving those feedback from the people around?
Yeah, I think, issues are most of the times related to anxiety, stress, depression, and it's a long time issue, Of course, in difficulties and in crises such as pandemic, you witness more range of these issues, but it doesn't mean that it's only during that time. So we have a lot of cases related to anxiety, depression, and stress. At the same time, during pandemic, we had a lot of cases related to relationship conflicts because people had to stay at home and people had to work at home. Children had to do homeschooling, and it was a new challenge for everyone, how to get along with this new lifestyle. So that was something that we're working on it most of all, to teach people how to come up with new ideas, to be creative, and to stand each other, to be patient enough to each other to go through this new challenge easier.
Right. Isn't it something really strange, Sahar, when you mentioned that people actually had this relationship issues where people sitting together, like this time when there was no COVID, people would say we need family time, we need to be together. And when the time came, people started actually facing issues as well.
Exactly, because it's been forced, and it was a new thing. So when there is happening something new to you, you need time to learn how to cope with it. And I think that was mostly about COVID. It was new to everyone. So that's why we had this need to be together, because that was new to all of us and we were learning all together.
Right. And now currently, what are the main concerns, as an expert in this field, what are the main concerns you're seeing people with mental anxiety or mental issues? What are their main concerns?
It's difficult to answer this question specifically, but I can say majority of people who come to mental health clinics, they come for self-growth. They come for self-development. And that's why we always tell them you have to be very proud of yourself if you come to therapy session, because it's not an easy thing to do. If you come, it means that you are taking care of yourself. You're putting yourself first, prioritizing yourself. And they come to promote their skills in different areas. Sometimes it could be anxiety, sometimes it could be stress, depression, emotions regulation, sometimes it could be parenting, something about your children, but altogether it's about self-growth and self-development.
Sahar, you mentioned something about that people need to prioritize themselves first. Is this a good thing or a bad thing when we're trying to encapsulate into humans' mind? A lot of times people think oh, I'm putting myself first, maybe because I'm a selfish person. How do you define that part?
So that's a very nice question, because there is a delicate difference between being selfish and self-full. So when you put yourself first and you prioritize yourself, it means that you want to be in a good shape to be able to serve others better. Because if you are not healthy enough, if you are not happy enough, then how can you help others? How can you be a good mother? How can you be a good father, a good friend? That's why even when you are in the airplane, I'm sure everyone have heard about this, that if something is happening, you have to put the mask for yourself first and then for your kid.
Right.
This is not being selfish. This is something reasonable because you have to be in a good shape to be able to help others better.
Right. And when it comes to techniques used by the psychologists, how does it differ before when, you had in-person session? What kind of techniques would a psychologist or an expert use to help calm the patient? And how did it differ when it went to online?
Of course, it's different, but that's the good thing I mentioned before, that when you face the new challenges, you become creative. So when we have online sessions, then we try to come up with new techniques which are applicable on online platform. And I think there is no issue about that. For the techniques that we can't do together online, we give them the homework and they will go do the homework and they'll come back and give us the feedback. So there is no issue. And I think both clients and psychologists are more creative right now in online sessions.
Right. And talking about the concerns and the queries and then people that were reaching out to you, said that not just from Oman, but people were reaching out across the globe. Talking about Oman specifically, which region or city you would say you were getting more feedback or concerns or questions from?
Basically, we are a team consists of 13 psychologists and counselors from different countries, different cultures. So you can see that we are very multicultural. That's why we have a lot of expats coming to the clinic from different countries. But at the same time, we have a lot of Omanis, fortunately, coming to the clinic. Most of them are from Muscat, but we have online sessions for other cities here in Oman.
Right. Sahar, I totally forgot to ask you, when you're talking about psychologists, when you're talking about counselors, what qualification or how do they get to that level that where they're able or, they are qualified enough to reach out people in time of help, in time of need?
Yeah, there is a difference between counselors, clinical psychologists, and psychiatrists, and that's why we have different departments in the clinic. We have a relationship department, which is working on any issues related to marriage, couples, workplace relationships, interpersonal conflicts. We have children departments for parenting and issues related to children, and we have life coaching, which is about how to set your goals, how to set your plans and reach your goal in a better way. And then we have our psychiatrists who are prescribing medication for you. But the first step for people to reach out us is to come to see how they're doing. If it was needed, the counselors and psychologists will refer them to the psychiatrist.
Right.
So going to the psychiatrist is not the first step, because some of the times it's not needed to take medication. Okay. And counselors basically work on daily issues that you have. And as I said, you want to develop your skills. You want to learn more techniques to be able to manage yourself better. Clinical psychologists basically work on clinical disorders, so it's a little bit more, severe, and then psychiatrists will prescribe medication for you.
Oh, okay. Thank you so much for explaining that step by step. And one thing that really got me thinking, you said that sometimes you really don't need medication, sometimes you just maybe need counseling.
Exactly.
So in that manner, Sahar, are there any kind of exercising or breathing exercising or something that you prescribe to the person who walks in and needs some kind of help? Because I'm sure just sitting down and talking would not do the job, right?
Yeah, right. So at Whispers of Serenity, we have different kind of rooms, and we have yoga room, we have a tent, we have art room. So based on the issue that our client have, we will go to different rooms. Sometimes we sit together and we paint something. Sometimes we sit in a yoga room and we do some mindful techniques together. Sometimes we play music together. Because mental health is in everything. It's not only something, in the books, something that you have to talk about it. So it's very easy when you can look at mental health through art, through music, through exercises. So we cover all these aspects, and we try to look at human as a soul, body, and mind all together.
That is absolutely so interesting. My God, when we talk about mental health, people think that you just need to go see an expert and he's gonna or she's gonna prescribe you medicine and that's about it. But knowing that there are so many ways of helping out and reaching out to people, like you said, music, art, or sometimes just lending your presence to that person. People are out there who are still too shy to reach out for help. And they somehow get these panic attacks or feel mental anxiety at home. What kind of tip would you like to give to them?
The first tip I can give them is to not try to fight with these emotions. I know anxiety, anger, fear, these are difficult emotions, but if you try to fight with them, if you try to kick them out, that would be difficult for you to deal with them. So first of all, try to embrace your feeling. Try to accept the feelings that you have, or and in the other way, feel your feelings, because they are there, all those emotions are there to send you a message, and that message is very important for you. If you receive that message, then it's easier to deal with your anxiety. So I guess what we do in therapy sessions is to go through that emotion, we sit together and we try to observe that emotion together. Because when we make peace with our emotions, then we welcome them, we receive the message, and then we accept ourselves, we are more integrated as a human being.
Well, thank you so much, Sahar, for sharing that piece of advice with our viewers. And thank you once again for taking out time and joining us, in the week when the Sultanate is celebrating the International Women's Day and across the globe as well. Thank you so much for your time and presence.
Thank you so much for having me today.
For more interesting videos and updates, stay tuned and keep watching TTV.